Today the topic of my video is myotomes. What is myotomes? Myotomes is that the muscles which are served by a single spinal nerve is called myotomes. Firstly, I get consult from my client. Assalamu alaikum. I'm Dr. Fatima. What's your name?
Walaikum assalam. My name is Maryam.
What's your age?
21 years.
Can you allow me to do some test on you?
Yes.
Thank you. C1. C1 is a neck flagon. I place my hand on the forehead of my client and ask the patient to resist my hand like this. Neck extension like this, and I ask the patient to resist my hand like this. C3 is lateral flagon of neck. Patient resist my hand. Okay, on both sides. C4 is shoulder elevation like this, and I place my hand over the shoulder and ask the patient to resist my hands. Okay. C5 is shoulder abduction. This is a shoulder abduction. And I ask the patient to resist my hand like this. Okay. C6 is elbow flagon. This is elbow flagon, and I ask the patient to resist my hand like this. I place my hand below the elbow, above the elbow, and second hand on the above the wrist. So C7 is elbow extension. I place my first hand above the elbow joint and second hand below the wrist joint and ask the patient to resist my hand. This is elbow extension. C8 is thumb extension. I place my hand above to hold the wrist and second hand above the thumb and ask the patient to resist my hand. T1 is finger abduction. For finger abduction, I place my hand like this and ask the patient to abduct their hands, open their fingers. T2 is finger adduction. For finger adduction, I place my fingers between these like this and ask the patient to squeeze their fingers. For the lower limb myotomes, firstly, I test the L1 and L2 for hip flagon. I place my hand above the knee joint and ask the patient to resist my hands like this. This is hip flagon test. L3 is knee extension. For knee extension, I ask the patient to perform like kick. For this, I place my hand above the knee and second hand anterior side of the leg and ask the patient to resist my hand. L4 is ankle dorsiflagon. For this, I place my hand posterior side of the ankle joint and second hand above the dorsum of the foot like this and ask the patient to resist my hand. L5 is big toe extension. For this, I place my hand above the big toe and ask the patient to extend their big toe like this. Next one is plantar flagon. For this, I place my first hand back to the ankle joint and second hand below the sole and ask the patient to resist my hand like this. S2 is knee flagon. Place my hand below the knee, like back to the knee, and ask the patient to resist my hand like this on both sides. These all myotomes perform on both sides. For test the myotomes, I apply all these tests on both sides bilaterally and check my client. So these are normal results. Thank you so much for your cooperation. Allah Hafiz.